Well, fears and concerns over the H1N1 virus continue to mount. And from the vaccine to washing hands, there's no doubt you have questions concerning the virus and prevention. Well, joining us this morning is Dr. Michael Sevilla. He's the Chief of Staff at Salem Community Hospital. You're right there in the ER, and among all these people that are calling and coming in, are you seeing a big influx of people coming in?
Yeah, I think the influx maybe started in the past couple of weeks. We're seeing a lot of fever-related illnesses. Is it really flu? Is it really a bacterial infection, earache, sore throat? We're really seeing it in my office, and I know the emergency rooms around the area are starting to really see that now too. Okay.
Now, parents are tending to panic, I think, because in the beginning when all this first started coming out, they were telling you if you didn't hit this within the first day or two, jump on it right away, it could get really bad, and then you have really bad respiratory problems. Now they're saying, wait, don't run to your emergency room. So what is the protocol? How should a parent decide what to do when their kid comes home from school with a fever?
It's very confusing because a lot of the symptoms are very similar. So you have fever, you can have cough, you can have runny nose. What I'm telling people is that, just kind of treat the basic stuff first. If you have a fever, give them fever-fighting medications. Make sure they get a lot of fluid because dehydration can also be a factor in this too. And also too, just kind of watch your child and see, because parents know, it's saying, well, he's not acting the way that he usually does, or she's not acting the way that she usually does. So those are the basic things that you can do in addition to contacting your healthcare provider.
Yeah, contact your physician, kind of run through the symptoms with them, and then maybe they can help you determine whether you need to make an office visit or just stay home and try to treat it yourself.
Exactly.
Okay. Now, as far as dehydration, because everybody says, oh, if they're dehydrated, that might be the time where you really want to take them to the doctor or you really want to get to the emergency room. What are the signs?
Well, the big thing is, are they able to keep fluids down? Now, solid foods, are not that big a deal, but if they are vomiting, if they're having a lot of diarrhea symptoms, not able to keep a lot of fluids down, that could even just be a subtle sign of just a little bit of fatigue, just not acting like themselves. So especially in the little kids, it could be just subtle signs like that that mom or dad need to call the doctor and say, hey, this is what's going on. What do we need to do?
Okay. Now, and also we've talked about the vaccine a lot, and I think more people are deciding, okay, we're going to get the vaccine, but now it's nowhere to be had. It's hard to track it down. What to do about that? I mean, is there ever a time where it's not worth going? I mean, is it getting too late to, you're going to get it anyway idea? What do you think?
Well, it's never too late to get it. Of course, right now, the most important thing is to get your seasonal flu vaccine that is out there. And before the H1N1 vaccine becomes available, I just got my H1N1 vaccination this week. And what we're seeing now is that distribution to more people are going to probably happen first week of November, middle of November. For right now, pregnant people, healthcare workers, first responders, those are the people that are getting it first this week.
Okay, very good. And we'll have much more to talk to you about in our second hour, so don't go too far. Well.